Welcome to Live with Hillsdale Hospital. Today is Monday, December 15th. How many days till Christmas? Like 10?
10 days.
Something like that. 10
Yeah.
days. Wow. Amazing. I'm JJ Hodshire, your host today, President, Chief Executive Officer of Hillsdale Hospital. And we're bringing you the latest of healthcare news happening right here in your community in Hillsdale Hospital. Some exciting things that we're going to talk about today. I have in the studio one of my good friends, and I can honestly say that. You know, it's a lot of times we spend as executives working on physician contracts and, physician schedules and physician wages. But with you, I just get a friendship, which is pretty darn good because I don't have to employ you. Right? Exactly. But it is my pleasure to have in the studio today, Dr. Alam, someone who I was able to be fortunate enough to meet through a mutual friend, Dr. Bidney. And it's been almost 3 years, 1 month. Has it been over 3 now?
No, almost 3 years.
Almost 3 years.
It's going to be 3 years in January.
3, okay, very good. 1 month away from 3 years. Dr. Alam, vascular surgeon, has a vascular clinic. We'll talk about all of your progress that you've made in Hillsdale. You don't hail from Hillsdale, but we're going to talk about that. So what I want to do is for our listeners today, Dr. Alam, who may not know you, and I would say, 3 years is relatively new to our community. Could you give a little of your backdrop, where you went to school, where you started practicing, and then I want to get you right up to the point where you started at Hillsdale.
All right. So this is going to be somewhat of a long answer.
All right. I'm ready.
So I went to medical school in Pakistan. And I finished medical school in 2000, and I came to the U.S. in 2002.
Very good.
I did my general surgery residency at Yale in Connecticut, one of the Yale hospitals. Then I did my vascular fellowship in Tennessee. I have a lot of family and friends in Chicago, and I have a lot of family and friends in Toronto. I wanted to be in the middle, so Michigan became the obvious choice.
Yeah.
So we came to Michigan. I've been in Michigan since my fellowship ended, since 2012 in Western Michigan. And my practice is in Battle Creek. That's our main office. I travel to Sturgis, Hillsdale, Coldwater, and obviously I have a clinic in Battle Creek. I operate in 5 different hospitals, Hillsdale being my favorite, obviously.
Thank you.
Then I go to Battle Creek and I go to Bronson, Kalamazoo, and I work in Coldwater and I work in Oaklawn.
And you have clinics in all these places, right?
I do.
So you have a clinic in Oaklawn, clinic at Hillsdale, and a clinic in all these other spaces, correct?
Yes, I do. The only place I don't have a clinic right now is Kalamazoo.
Okay.
But all the other places that I've named and mentioned, I have clinics everywhere.
So Dr. Alam, so you realize in 2000, all right, I want to come and we settle on Michigan, but let's go back a little bit further. When did you realize that you wanted to be a vascular surgeon? Because I know what you wanted to be to begin with, and we're not going to talk about that on this program, but that'll be for our podcast.
Yes.
But honestly, when did you realize, hey, I want to get into that versus general surgery versus any other discipline? Why vascular?
I actually decided in the middle of my residency, in my 4th year of residency, to go and interview for vascular. And I originally wanted to do vascular and cardiac both. But just with one fellowship, it was enough. During general surgery, I realized that the one thing I did not want to do was cancer surgery.
Okay.
And I really, really enjoyed tough vascular operations. So I sat down with some of my mentors and I talked to them, and they all said that, vascular may end up being a very good choice for you. And, I started working towards it in my 4th year of general surgery residency. I did a lot of vascular rotations. Then I applied to the fellowship, and then I mastered the fellowship in vascular. I still can very confidently say that the best 2 years of my life was the 2 years of vascular surgery fellowship that I did in Memphis. All we did was operate. We didn't do anything else. The only things I remember about Memphis is operating and sleeping.
Wow.
That's
Did
it.
you even getting good food, ribs, that good stuff? No. Not in Memphis.
Not in Memphis.
Oh, man.
But all I did was we operated. It was a very busy program. I had a very good time operating there. Then we came down here, and, it's been a dream come true. It's been great.
So can I talk a little, personally, you integrated your family into Michigan. Your wife's a psychiatrist. Am I allowed to say that? Okay.
Yes, you are.
All right. So you're both in the medical practice. And then children?
We have 3 boys.
Yeah.
My oldest is an econ major at University of Michigan.
Okay.
Our second one is a sophomore in high school, and my third one is in 8th grade.
Anyone want to be a vascular surgeon?
Actually, my middle son wants to be a vascular
Does he?
surgeon, and he planned it in his head. I don't know how he came up with that idea. He planned exactly what I did in number of years, and he realized if he went to vascular fellowship, he will be done 1 year before I retire, and then he's going to take over my practice.
No, he's going to buy your practice. Let's make sure that.
Yeah, well,
he's got to
we'll
take care of dad the rest of his
well,
life.
absolutely, he will have to.
There is that.
But that's the only one who wants to do vascular, or at least right now. They're so young. Whatever they want to do, I hope they're successful and happy.
And your oldest son just started. This is his first, or no, second year.
This is his third year.
Is it the third year already?
Yes, he's a junior.
He started when you first started working here.
Yes.
So U of M.
U of M.
And enjoys the experience.
He loves the experience. He's having more fun than anyone should be allowed to have in college.
Exactly. Well, there is that. But it's like driving a brand new car every year into the water, just walking away, paying that tuition, isn't it? It's just really great.
It's almost like that.
It is like it. Yeah. Well, you're a family man. You're well versed in vascular. We're very excited that we can share some information with our audience today. Mm-hmm. And in terms of what you've done for Hillsdale. And I want to talk about that at first because, we entered this relationship with you, knowing that our community wanted to stay in Hillsdale for their surgical procedures.
Yes.
And they didn't have that option.
Yeah.
They were taken other places and they wanted to be here at Hillsdale Hospital. And that has been very rewarding for not only us as a hospital system, but also for the patient to stay local. Now, before we talk a little bit about, all of those things in your clinic, I want to talk, let's just start at the basic. What is vascular care? What does it involve? What are you working on a day-to-day basis? When should someone come see you for vascular care? Is it all referral driven? A lot of questions that we're going to answer today. Let's start with what is it?
Okay. So basically, I will try to keep it as simple as I can for your listeners, right? Anyone who gets to be over 60 years old has a vascular problem somewhere in their body. Okay?
Just going to happen.
Vascular means blood vessels, right? So blood vessels, we have arterial blood vessels, we have venous blood vessels, and we have lymphatic blood vessels. In all three of these systems, you can have problems as we get older. Now, with all the problems that develop, everybody doesn't suffer from the problem. Like, for example, as we get older, like you are old and all your hair are white, it doesn't bother you, but it may bother some people, right?
Right.
In the same way, when people get older, the blood vessels in their legs, in their neck, like the carotid arteries, they can get what is called atherosclerotic disease or hardening of the arteries. And that hardening results in lack of blood flow to the end organ. Okay. Let's talk about the brain for a second. If there's blood vessels that go from the heart through our neck to the brain, if those blood vessels develop high-grade stenosis or high-grade blockage, which is defined as more than 70%, their chances of stroke increase significantly. So this is where vascular surgery comes in. We take them to the OR, we clean up the artery, we close it up, and then their chances of stroke becomes the same as the rest of the population.
Which is still high. It's based on maybe some comorbid cases.
Well, it's the chances of someone having a stroke with carotid stenosis are much higher than someone who does not have carotid blockage.
Right.
So, so that is one type of thing. The other thing we do is the same type of problem happens in the leg. That is probably one of the most common problems in our area is the legs, because you get blockage of blood vessels in the legs, which results in pain in the leg, pain in the foot, numbness and tingling in the foot. When those things happen, we have to go in and open those up. Sometimes we can use stents and balloons. Sometimes we have to do bypasses, which means if the blockage is so severe that we cannot cross it with a wire to balloon it, we have to do a bypass. The same concept that we do in the heart. It's conceptually the same thing. Another thing that we do, two more things that I would like to talk about is aneurysms, right? Aneurysms develop in all blood vessels of the body, but they're most common, all arteries of the body, but they're most common in the aorta, which is the largest blood vessel of the body. And the most common area of that is in the belly, below the kidneys. And that is nature's silent time bomb.
Yeah, because you don't always feel it, right?
You actually almost never feel it.
it.
Somebody may, I've had patients like that who are very thin, and their granddaughter or their grandson says, "Oh, there's a ball in your belly," and they feel the pulsation of the aorta,
Oh,
and then
wow.
they get medical care. But anyone whose aneurysm is above 5 needs to be surgically treated.
Mhm.
For men, it's generally 5.5. For women, 5 is the size where you have to
Hmm.
treat it. And we have treated a lot of aneurysms here in Hillsdale Hospital.
Yeah.
And these people were either A, they did not know they had aneurysms, or B, they were going out of town to get this taken care of. We're able to do all of that here now, which we've been doing for almost 2.5 years. I didn't
'Cause you
start
didn't
doing
start, right.
aneurysms in the beginning,
Right.
but we started within 6 months once our team was trained and we knew everybody was working well. So those are the things. Another problem is ulcers and wounds in the legs, right? Almost every leg or foot wound has some type of a vascular involvement in it. If you're diabetic, if you're non-diabetic, if you have an ulcer or wound in the leg, it has a vascular involvement. It
Mhm.
could be arterial disease, which is blood going down, or it could be venous disease, which is blood coming up,
Mhm.
or it could be combination of both. So those people need to be taken care of at the wound clinic,
Mhm.
and they need to have a vascular consultation. They need to have ultrasounds done. And as soon as we find out that there's a problem, that problem needs to be fixed.
So how are we finding the initial onset problem? So in many cases, you're indicating that person would never know
Yeah.
that they had an aneurysm. So is this regular checkups? Where are we discovering this?
So these things are discovered with regular checkups. That is where the primary care doctors are of paramount importance.
Yeah.
Right. So the primary care providers see the patients at least once a year, is my understanding, based on Medicare.
Right.
You have to see them once a
Right.
year, and you have to
Wellness check.
examine them once a
Yep.
year. When patients are examined, some patients may not have pulses in the feet. They need to see vascular surgeon, because I saw a gentleman today, actually. I saw him after surgery. He hasn't walked in 6 months, but his foot was completely cold. And then his primary care doctor found it,
Oh my God.
sent him to me, and he needed a big bypass. I did a bypass just to save his leg.
Wow.
He doesn't walk because of back problems, but he does not want back surgery, but his leg was saved because of that. Otherwise, he would have lost that leg.
My God.
He was so bad. But it was only discovered because the primary care doctor took the time to, take his socks and shoes off and feel his foot
feel
and
it,
try to
yeah.
feel a pulse. Also, for the carotid, like I was talking, you put a stethoscope on the carotid, and you can hear what is called a bruit,
Mhm.
which is like blood doesn't flow in a straight line. It feels like there's a problem with blood flow. And then once you see that, once you hear that,
Mhm.
then you get the people to the right area. Then the patients get ultrasounds. Then once the ultrasound is done, then we can diagnose them completely and
Mhm.
correctly.
Mhm.
Same thing with the aneurysm. Once you touch it, you realize, oh, there's a problem there. A lot of patients get diagnosed with aneurysms by chiropractors, because
Hmm.
chiropractors do back x-ray. And when they do a back x-ray, a
Hmm.
lot of aneurysms have calcification or calcium in the wall,
Wow.
so it lights up.
Wow.
At least last year I saw 5 aneurysms from chiropractors,
From a chiropractor.
because they find it, and then I think they call the primary care doctor, and the primary care doctor
Yeah.
calls us.
So you would historically, patient gets a referral to you,
Mhm.
comes to your clinic.
Mhm.
You then order some testing.
Mhm.
Talk to us about the testing. When do you make the determination for surgical intervention?
So if we're talking only about aneurysms right now,
Let's just talk about aneurysms.
Okay, so in aneurysms, what we do is, once someone comes to my office and they say, oh, they have an aneurysm, so we get an ultrasound.
Mhm.
An ultrasound shows us the size of the aneurysm. Okay, let's just say the aneurysm is about 4.9 or 5 centimeters in
Mhm.
size,
Mhm.
or maybe even 6 centimeters in size. The next step is we get a CT scan, and that CT scan is done for operative planning, so we can see where the wires and balloons are going up, because most of these aneurysms are fixed with stent grafts.
Mhm.
They're not done in the old-fashioned way, where you cut from for big belly incision is not made these days.
Yeah.
It's still made, but in less than 5% of the patients
Okay.
who are not
Right.
candidates for
Right.
endografts.
But 20 years ago,
Mhm.
it was slice and dice.
Oh, everything was open.
Yes.
Maybe 25 years ago, but everything was open at
Yeah.
that time. Yeah.
Yeah.
And it's a very good open surgery, but It takes the patients
And
more
the
than a month to
healing time.
recover.
Oh my God, it's unreal.
It takes a long time. I did an aneurysm last Friday. The patient was home on Saturday.
It's just amazing.
It is.
And Dr. Lam, you're doing these here
Oh, of course.
at Hillsdale. Now, there's also a lot of belief that, when I go out and speak and I go across the country and have conversations with people, they cannot believe that we're performing, EVARs here at our hospital. Like,
Wow.
really, at a rural hospital, you're doing that? And we talk about neurosurgery, but then we talk about vascular surgery. There's this misnomer out in every small community. It's not just Hillsdale that, oh, my community hospital can't do that. They're too small. I remember what happened back in the 70s with mom, but medicine's changed over the last 30 and 40 years,
Of course.
obviously. And our hospital is equipped to engage in these major procedures. Is that correct? And I want you, from your perspective, I didn't prompt you on this, but you go to a lot of large facilities, tertiary centers. You go to basically some smaller hospitals like Hillsdale. Do we have what it takes?
That's a very good question. And I think the number one thing is the desire of doing it.
Mm-hmm.
Once we have the desire of providing care in Hillsdale Hospital to the Hillsdale community, then we start working in the correct direction.
Mm-hmm.
Now, of all the surgeons who are here, I think I started before neurosurgery did, and I started before urology
You
did.
did.
And I'll tell you how it works. First, it's the desire to work. Then, slowly, we develop things, right? I mean, we don't have $1 billion sitting so we can buy everything in one day.
Right.
It takes time. But in time, we have been able to get brand new C-arms that are as good as a machine that you would find at University of Michigan.
Yeah.
We have been able to train our team to a level of any other tertiary hospital
Mhm.
system in our area. We have 4 ICU beds. I would like to have 40 ICU
I
beds,
know.
but
I'm
we have
working on that.
well, thank you.
I am.
We have 4 ICU beds, but in those 4 ICU beds, we provide the patient the best possible care that can be
We
provided.
do.
Now, are we exactly at the level of, say, University of Michigan or
Mhm.
Cornell or whatever? No. However, we don't need to be.
Right.
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 We are not doing any genetic testing for
Correct.
pediatric patients.
Yes.
That happens at University of Michigan.
Right.
But as a community hospital, we're able to take care of, let's talk about vascular surgery now.
Mhm.
We're able to take care of 95 to 99% of the vascular surgical problems
It's
in a
incredible.
community hospital in a way where we don't have a lot of complication. Actually, we have not had a single
No, none.
major complication.
None.
Since I started in 3 years, I had one take back because of bleeding,
Mhm.
which was 2 years later, and the patient fell off the bed and started bleeding.
Yeah.
Actually, he did not even fall off the
We-
bed. He wanted to walk and he fell. He wanted to walk by himself and he fell.
Mhm.
And then we had to take him back. But that is our only take back. So our quality of vascular
Incredible.
care
Yeah,
is
Second to
very
none.
high.
It is very high.
And there are some patients that I have seen in my office, and I told them, you will be best served at a big university hospital
Sure.
because this is a problem that they take care of 10 or 12 of these a year.
day. Yeah.
I see 1 or 2 in 2
Yeah.
years.
These people see it daily.
Yeah, so
Yeah.
you're better off going to those
Yeah.
people.
Yeah.
However, for majority of the problems, run-of-the-mill carotid,
Yeah.
EVARs, bypasses, all these
Probably
things,
95% of what you see. right?
More than that, actually,
Yeah.
we can do here. Whatever I can do in Battle Creek Hospital, I can do here. Or whatever I can do in Kalamazoo, for the most part, I
Right.
can do here. For the most part, in both those Bronson hospitals, there's something where we are lacking, which I think we are going to develop over the next 3 to 5 years, and that's a cath lab. Once we have a cath lab,
Yeah.
we will have a proper cardiac system
Right.
here,
Right.
which is why some of the patients who are high cardiac risk, I don't do them here.
Correct.
I take
You
them
just-
out of
yeah,
here and I
you
take
can't
them
take
to a
the
place where
Yeah.
cardiology is available
Yeah,
24/7.
you just can't take the risk.
So I think for the community, it's a very good thing to understand that we are completely 100% committed
Mhm.
to creating a very high level vascular program
Agree.
in this
Well,
hospital,
you've already
in
done
this
it.
town. Well, thank God, but it has to grow.
Yeah.
I'm
It does
gonna
have
be,
to grow.
I am in the process. Well, I shouldn't say in the process, but I am thinking very seriously about increasing the size of my practice in terms of getting the number of doctors. So we may end up looking for another partner in the next 2 to 5
Yeah.
years.
It's very exciting.
Um,
But you got to
excuse me.
grow the business.
You got to grow the business. You got to
Yeah.
grow the practice, and the only way it grows is by providing high quality care.
That's right.
There's no other
There's
way
no
of
other
growing
way.
it.
There's because the reputation will kill.
Yeah, and you
Absolutely.
know, you go, you see the patients, you take care of one person, they bring
5 other church people.
or
Two-
their
two
husband or
family
their
members.
wife or
That's
family
right.
members. So
Yeah.
that's how it's growing. I hope I answered your question about
Yeah.
vascular
So
surgery.
you did, and we talked about the relationship that the hospital plays with you. I want to talk. I want to take a little sidestep here because I want you to share with us. We have some pretty incredible staff that you work with.
Oh, of course.
In the OR and such, and you have the tools to do your job. You have the staff. You know, talk a little bit about the relationship between the office right now in your practice and how we get things scheduled and all of that.
Yes. So the Hillsdale Hospital scheduling people in the OR are the easiest people to work with in the whole world.
That's great.
My office picks up the phone, calls them once, and you know, the best part is they say, yes, we're going to put it on, or they say, no, we're sorry, we cannot put it on.
Right.
There's no back and forth, right? So I know, and they know, and everybody knows
Clear.
what we can do. 90% of the time, we're able to put the cases on that need to be put on. My operative day here is Friday. Sometimes I do cases on Monday. I have done cases here on Wednesday and Thursday as well.
Right.
And I call them and they're like, okay, we can do it. Or I'm sorry, we cannot do it. So it gets done. That is the best way of scheduling cases. The OR staff, I mean, initially I thought I was new. That's why they were doing it. But they really
No,
go
they care.
out of
They
their
care.
way
They do.
to make life easy for our patients and me.
They do.
They really do.
Yeah.
And I'm sure they do it for every other specialty as well.
Yeah.
But we are very blessed to have very good staff.
We do have great staff. You have great staff in your practice as
Mhm.
well. If someone today thinks I need to go see a vascular surgeon,
Mhm.
is it 100% referral requirement, or can they self-referral?
They can self-refer. Actually, today I saw 3 self-referred patients.
Just said,
You-
we heard about you.
We heard about you, or you know, our neighbor comes to you, or they just pick up the phone and they
Yeah.
call our office and they can make an appointment and they can come in.
And we'll put in the show notes your office number, so that way if folks want to reach out to you, that's one way that they can do it.
Mhm.
But let's okay, so let's step away from the, you know, as you look at aneurysms and all of that, let's step away. What other types of complications are you seeing? What type of other surgical interventions are you doing? Because you've told me we have kind of a high incident rate of people that smoke in our community that impacts their circulation, but you're doing a lot with veins. You're doing a lot. Talk to us about that.
So the smoking population, and especially the diabetic smoking population, they get PAD or high-grade blockages in the blood vessels of their leg. If it is left untreated, about 15 to 20% of those people are going to end up with an amputation. If someone has a problem today, I cannot tell you who is going to be amputated and who will not. So, but the data is very clear. 15 to 20% of the people become critical and then they end up losing their leg at the very end. Now, our job is to find these people. The way to fix these people is, nowadays, the first line of management is endovascular, which is needles, wires, balloons, and catheters. You go in, you clean up the blood vessels. Sometimes you have to put a stent, same as you do in the heart. I do some of those here in the hospital, but we really need a cath lab for that. So I do it in my office as well. But if you're unable to do that, or you have done it a couple of times and they keep on coming back with problems, then you do a bypass. A bypass is basically, if there's an area of problem, we go above and we go below, like a plumbing job, and we fix the blood flow. We can use the patient's own vein, or we can use a bypass graft material that is available in the market to do the bypass. And we've done a lot of those here as well. We've done lots of bypasses here. I think in January I have 4 bypasses.
It's incredible.
Yeah.
And we're talking, they're out next day. Day after?
Well, bypasses generally stay in the hospital for 2 to 5 days.
2 to 5.
And I'm saying 2 to 5 because it is completely dependent on patient factors.
Right.
I did a bypass in a gentleman who is a walking, talking, working person. I did the bypass. Next day, he wanted to leave. I did a bypass in a nursing home patient, stayed in the hospital for 8, 9 days.
Right. But the 8, 9 is uncommon.
It's
The
uncommon.
1 is uncommon.
The one is
So 2
2 to 5 days
2 to
is
5
what I
days.
always tell people.
Yeah.
When I do a surgery on Friday, usually they're out by Monday.
So you do the surgery,
Mhm.
right? And patient's inpatient for a few days,
Mhm.
maybe 3. Let's just say that's the average. Post-discharge, when do you see them?
I generally, if they go over the weekend, I see them on Monday because
So
Monday
you're
is
ready
my
to see them
clinic.
back.
I see them on Monday. My office basically has an open door. Anybody can come in at any time.
Yep.
Right?
So you see them back again on that Monday.
On that Monday.
And then what type of interaction is it after that with you? Is it weekly, monthly? Is it just as needed?
So if I have put staples on
Yep.
their skin, I see them weekly.
Weekly.
I take the staples out in 2 weeks.
Okay.
All right. Once the staples are out and the incision is completely healed and they feel up to it,
Mhm.
I let them drive, and then I see them back in 3 months.
Yeah.
So every 3 months for the first year, every 6 months for the second year, and then yearly thereafter.
Mhm. So let's talk about someone's listening today and
Mhm.
they don't really understand, when do I go to the vascular surgeon? So what type of, obviously the aneurysm, you're not going to have pain, but pain of legs, when do I go?
So,
When's the appropriate time?
I'll tell you this. I see a lot of patients who have no vascular problems. All right. But they come to our clinic and they are concerned about leg pain.
Okay.
A lot of the leg pain originates in the knee or the hip or the back, but patients don't know that. Once they come in and they sit down and they talk to us,
Mhm.
and I feel their pulses, and if their pulses are normal and they have no swelling and their veins look fine, I tell them you do not have a vascular problem, it's something else.
Okay.
However, if it looks like to me on my exam that there is a vascular problem, then I get the ultrasounds.
Mhm.
And then that's where the ball starts rolling.
Mhm.
Excuse me. And then once we find the problem in the ultrasound,
Mhm.
based on what the problem is, we offer the treatment.
Yeah. Let's talk a little bit about, they get in the clinic, you identify that they need a course of action, including surgical intervention. But I want to go back to the 15 to 20% population that may end up with an amputation. How is that avoidable? Is it early detection, or what is it?
It's not 15 to 20% of the population. It's 15 to 20% of the people who have bad disease in their legs.
Okay.
So, I mean, that changes
That changes the
significantly. It's like
percentage.
1% or less of the population to 15 to
To
20%
15 to
of
20%.
the people who have bad disease.
Yeah.
So, the only way to avoid that
Yeah.
is early diagnosis and lifestyle changes. Lifestyle changes being more important than early diagnosis.
Example.
Example, I have a patient who wants to drink 2 gallons of Mountain Dew every day.
Wow. 2 gallons.
2 gallons.
Wow.
Right, big bottle.
That's why I drink Monsters. I will not
Every day.
drink Mountain Dew.
No matter what I say to them, they will not quit smoking.
Oh.
So they come in, their blood sugar A1C, hemoglobin A1C, is always above 10. Okay. Obviously they haven't quit smoking, and they've lost a couple of toes.
Yeah, it's not good.
And both those things, Mountain Dew and smoking, are both extremely addictive.
Mhm.
So people have to get help.
Yeah.
To get rid of those things.
Yeah.
And that lifestyle change is more important than anything else.
Yeah.
And once they have the lifestyle change down, then our jobs come in, right? Your job as a hospital to provide them a place where they can get care. My job as a doctor to provide them care where their problem is taken care of. But they have to take responsibility. Vascular surgery is something, or vascular problems are some things where people have to be responsible adults.
Yeah.
If they do not take part in their care, the
Bad
care
outcomes.
will inevitably result in bad outcomes. And there's only 3 bad outcomes in vascular surgery.
Yeah.
Amputation, stroke, and death.
Death.
That's it.
And those are 3 bad ones.
The worst ones
Yeah.
that you can think of.
Yeah.
So I talk to the people. I'm very proud of this. I have made at least 20 to 30 people that I can think in the back of my head right now who have quit smoking.
That's great.
Because quitting smoking is very difficult.
And you see the results how soon? Relatively quick?
Oh, day 5, day 1.
Day 1.
So, if you look, I don't remember that data completely, but if you look at it on day 1, I think your breathing gets better. On day 5, your smell gets better. Basically, it goes like this. And at 15 years, your chances of having lung cancer is equal to someone who has never smoked.
Wow.
So there's a very good table that goes from day 1 to 15 years and shows how people's lives can change when they quit smoking. It's easier to scare men than women, is my experience, because smoking also results in ED. And when you talk to them about that, they understand what you're talking about, and they think it's more serious. So that's my experience.
But you still will take a patient in your practice that smokes.
Of course.
Yeah, I mean, there's some providers that say, nope, I'm not going to take them, but you still deal with that. And let's end with, as we talk about amputation, where are you doing those? So the amputations themselves, are you doing those at a big center?
Here.
Right here.
Hillsdale Hospital is where I do all of the Hillsdale patients. There's a couple of patients who don't want to come to this hospital for whatever reasons may be. Apart from that, everyone that I've seen in Hillsdale Hospital that I operate on, I bring them here. Over the course of the last 3 years, there have been 3 or 4 patients that I've sent elsewhere because of funky problems like we talked about. But whatever I do here. And sometimes I do, like, the cath lab cases, I do them in my office in Battle Creek.
So let's end on a positive note.
Okay.
Without naming a name, what's been one of your favorite success stories? And I know you've had a lot, and we've talked. And while you think of that, I will remind you of 3 years ago, almost to this day, when I took you to dinner, and I bought, of course,
for the first time in your life.
Yeah,
maybe the last as well.
Yeah, no, I think I bought last night.
Oh, you did. You did. I take that back. I'm sorry.
Scallops, and shrimps, and steaks. But anyway, so I do recall you looked at me, and I was so excited. And you finally looked at me and across the table, and you said, "Cool your jets, man." You're like, "We have to build this." And I think, before you answer the best story, the best experience that you've had with a patient success story is we're building this. It's been building, and you've made a lot of progress, but there's more to do.
Of course.
And I'm excited about some of the procedures that we can engage in, working for Cath Lab and working with the team up in wound care. I brought a podiatrist here because you wanted it. Not that we never ever employed a podiatrist before, but we did that because you needed it as a continuum of care, and I needed it in the wound care clinic as well. But those are the things that it's like, wow, we're building this as we go, because we feel it's so important with the population we have here that can't travel.
It cannot.
It's important. And I think I've cooled my jets, but I still am excited about.
I'll say a couple of things. One, the first thing, I'll correct you in one small thing. It's not that I wanted the podiatrist or you wanted the podiatrist.
True.
Our community needs a podiatrist.
You're right.
That's number
Absolutely.
one. And she's very, very good on you. Our podiatrist is wonderful.
She's amazing.
So that's one. Two, to build a long-lasting program, you need 10 years. At least 10 years for a long-lasting, high-quality program. And then you have to hand the baton over to somebody in about 15-ish years so they can run it with the same way. You and I are both going to die one day, right? You're already very old. I still have 10, 15 more years. But
you are 1 year older than I am.
No, I'm not. I'm younger than you are.
I don't know about that.
How old are you?
51.
49.
Oh, okay. All right. 2 years younger. All right.
Okay. So, well, I'm going to be 50 very soon.
Okay.
But in any case, getting back to the seriousness of the issue, it takes at least 10 years. It takes a lot of patience. It takes a lot of hard work. You have to do the things right.
You do.
Even when you're trying to do everything right, you still screw up.
Yeah.
And you have to take that as part of the building process and learn from it. Like I said, right now I drive an hour and a half to come here.
I know you do, and I'm greatly pleased with your investment in
thank you.
Hillsdale and for our patients. But there is not a week that goes by that I don't hear from a patient that says thank you for Dr. Alam.
Oh,
And we have a transportation issue in this town. People can't get to Battle Creek. They can't drive
I know.
to Ann Arbor. We're
know.
talking about a population that does not have the wherewithal to do that. So having you come to their backyard is critically important. And you're at Three Meadows, beautiful location.
Oh, it's a beautiful location. Yes, all the doctors are there.
Yeah.
Actually, I am. Maybe they're irritated by me or annoyed by me because I walk into their offices. If I have a question, I just
they love it.
I walk into their office. I find the doctor whose
They love
patient
it.
I'm seeing, and
Yeah.
then we start talking.
They said other than your bad dad jokes, they absolutely love it. So as we conclude today,
Mhm.
A success story that you're most proud of in your career that you're like, you know what, it brings it all home.
You know, I not of my career, but I'll talk about Hillsdale. One of the earliest patients I saw here was a patient that had been digged around by multiple different surgeons in the area. Again, no naming names. Then somebody sent her to Jackson.
Yeah.
And she had a horrible surgery done there. I shouldn't say horrible, but she did not have the correct surgery done there. And she came to me and her foot was about to fall off.
Mm.
That was my first bypass here.
Mm.
And our team was just at the time where we were ready.
Yeah.
You know, or maybe you weren't even ready and I pushed it.
You pushed it.
But I told her, I'm going to do your bypass. I'm going to do your bypass here. The bypass is 2.5 years old. I saw her in the office maybe about a month ago. Her other leg has a problem now, and I'm going to do a bypass in the other leg.
Yeah.
But that bypass looks absolutely wonderful.
Isn't that amazing?
And
Saved her.
Oh, of course, I saved her leg. I don't know if I saved her, but I definitely saved her
Well,
leg.
yeah, absolutely. Well, I mean, when you lose a member of your body,
Yeah.
it's a psychological
Yes.
battle that you face, and that's tough.
It is. It's a complete life-changing. An
It is.
amputation is a complete
It is.
life-changing
It is.
experience. And there's very good data when patients have amputations in both their legs,
Yeah.
above the knee. They're all dead in 3 months.
I know. I've heard some very sobering statistics.
Yeah.
That is very sad. So, you know, obviously making a difference in people's lives and one patient at a time. And I'm so grateful for the work that you're doing, not only, you know, for patients from throughout the community, but you've taken good care of my family.
Oh,
and
it's
I'm
my
very
pleasure.
and I'm
Like
very
I said earlier, it's
grateful because of that.
my pleasure.
And the team now, you know, we're moving forward. We got a great OR team, got great anesthesia. I think you would agree with that. We have great radiology now.
Yes.
Everything's coming together, and you work closely with wound care. I think this is all coming together for the very good.
Oh, absolutely. There is not one thing that I would add to what we've been able to do in the past 3 years. For a 3-year-old program, we are at the 99th percentile.
Isn't that amazing? It's just absolutely incredible.
And I not only believe it, I can prove it with all the numbers that we have.
Yeah.
And we have done extremely, extremely well. I actually presented our experience last year
at a conference, right?
It was not a conference.
Okay.
It was a Society of Vascular Surgery leadership meeting and course. And they gave everyone some type of homework and presentation about what they had done.
Mm-hmm.
And mine was the most unique because, all the people there were like, university doctors. And they basically were all doing the variation of the same thing. That we created this team, we created a wound care team, we created this, we created that. And I told them I created vascular surgery in a small town that did not have vascular surgery.
Created it.
And they were extremely impressed by it. And they were very, everyone enjoyed the idea that we were able to do.
I provided you a lot of statistics for that.
Not a lot, but you provided me some statistics.
I would think maybe a dinner is due for that, but maybe I know you took me to Fazoli's at one time. That was kind of a fun place. But I do believe we have one question from our audience. Question, Kirsten?
Do you need a referral to see Dr. Alam?
No, you do not. You guys can have my phone number. You're going to add
We're
it
going to
to
put
the
it on.
thing.
We're going to put it on the screen. Yeah.
And our practice is called Vascular Health Center. And like I said, it's based out of Battle Creek, but I come here every Monday. I'm going on vacation for 2 Mondays.
Mm.
So, but after that, when I come back, it's going to be great.
And what is, I mean, are you out far for scheduling, or you can get people in relatively soon, right?
Oh, I see people.
You can
see-
make appointments.
See the beauty of, excuse me, the beauty of my practice for me is that I work with 3 gals who come with me here. So if someone picked up the phone and called us at 9
They're
a.m.
going
and
to
said,
get it.
I would like to see Alam today, they will figure out a way.
To make
They
it
will
work.
create a hole to make it work.
That's great. That's great.
So it works out well. There's no one who has ever waited for more than a week or
Yeah.
2 weeks to see me.
Well, listen, thank you.
It's my pleasure.
I know you got a busy schedule today, so I won't keep you any longer. It's been a great dialogue and discussion.
Mhm.
Thank you for making a commitment to come to a rural community. You know, you came here, never been to Hillsdale before 3 years ago.
Yes.
You're like, this is different.
I actually met you.
You did.
Well, I had been to Hillsdale once
Yeah.
to,
Okay.
to see Dr. Bidney.
Yes.
She invited me to her office.
She did. Yeah.
And I
That's
came
how
in-
we connected.
and then she walked me from her office to
Yeah,
the hospital.
with a 2-minute warning that she wanted to meet.
Yeah, and then you weren't here, and then you and I met at
We did.
dinner.
We did. And it was an incredible conversation about how do you save rural hospitals in America.
Yes.
And the way you do it is you bring resources to them. And you believed in that vision that I had, and you've been with us ever since then. And I want to thank you.
I say that all the time.
Yeah.
The health of a community is completely dependent on the health of their hospital.
It sure is. You look at communities that lose their hospital, look at the health and the wellness,
Yes.
financial as well as physical.
Yes.
Wellness of that community deteriorates rapidly.
Mhm.
And that's what we're doing here. We're saving, rural America hospitals by advocating to keep those hospitals independent and strong in their respective communities. And that creates opportunities like this for partnerships,
Of course.
friendships, alignment, where we work together. You're utilizing the hospital as a surgery center. You want your own independence. You've already told me a million times you don't want to be employed.
Of
That's
course.
great. And you want to run this on your own because of the success of your business opportunities. And we as a community are blessed to have the services here. So thank you very much, Dr.
And
Lam,
thank you for your partnership.
your commitment.
It's been wonderful.
It's
for
great.
me.
And we will put in the show notes how you can reach Dr. Alam's office. And if you're looking for an appointment, same day, it sounds like even at times, get same day appointments. And then if you do have issues that you talk to your primary care about, you can also get the referral through that process as well. And the referral process will come right to Dr. Alam's office. So again, thank you for joining us, Dr. Alam. Thank you to our listeners for your commitment, for your participation. It is your participation at our local hospital that keeps us open. Allows us the opportunity to continue to serve our community through specialty services like this. So if you want to connect with us more, you can go to hillsdalehospital.com. If you're looking to join an award-winning team, look no further. Hillsdale Hospital is a place to land. You can go to our website, hillsdalehospital.com, /careers under the career tab. You can find all the current opportunities. And it's not just you have to have a 4-year degree, a 6-year degree, a 10-year degree. You can actually start working in one of our departments. We have many success stories of people that have started out in admitting and phlebotomy who are now nurses and doing great things in leadership. There are plenty of opportunities for you if you want to join an award-winning team. If you want to volunteer, you know what? Great place to do that as well. You can look for opportunities to volunteer in our gift shop or other departments. It's great. It's a great responsibility that you can give back to your community. And then if you have school age, high school age children who are graduating and looking at a nursing career, we're going to be announcing it very, very soon. The Doris Worley Scholarship, Nursing Scholarship Program. It is named after her for the great work. We have more on that in the future, but we are excited to be able to once again offer that nursing scholarship to our community. If you're interested in a nursing scholarship and you're a senior, going to graduate in 26, in May, we'll have some announcements out at the first part of this year about how you can apply. But we'd love to be able to sponsor that education, bring you back here to Hillsdale. The number of years that you go to school is the number of years that we ask you to work for Hillsdale Hospital. So you can catch more programs like this every week on live. We're at WCSR 102.5 Buzz as well, 92.1 WCSR, where we talk about current issues like this, the state of health and healthcare in Hillsdale County. Also check out our national podcast, Rural Health Today, wherever you subscribe. Download Rural Health Today. We'd love to hear from you on any of our social media sites. If you have a story that you'd like to share, we're doing some stories of our patients and the care that they receive here. Reach out to us. We'd love to hear from you. Your neighbors want to hear from you. What type of care did you receive while you were at Hillsdale? And we'd love for you to drop us a line, because the encouragement that our staff need to continue this, it's a tough job, is very important. And so please reach out any way that you want on social media. We'd love to hear from you. And until next week, stay safe, stay strong, and remember the power of rule.